So in this video we will be discussing how you can assess the severity of dyspnea. Okay, we have already discussed that dyspnea is caused by the multiple factors, and it has multiple underlying pathology, underlying mechanisms, so it is very difficult to assess. Okay, and there is no universal uniformly agreed tool. The consensus opinion is that the dyspnea should be formally assessed in context most relevant and beneficial for the patient's management. So it should be assessed according to the benefit, so that it can benefit the patient's management, and special domains being measured should be adequately described. Okay, so for the respiratory causes of the dyspnea, we mostly use MMRC grading. MMRC grading means modified medical research council dyspnea scale. Okay, and the MMRC grading starts from the 0, 1, 2, 3, 4. 0 means it is normal, that means not troubled by. 0 means not troubled by breathlessness, that means there is no breathlessness. Okay, except with strenuous exercise, that means it is normal. Okay, in the normal individuals we have dyspnea on strenuous exercise, but there is no dyspnea, no trouble of dyspnea at other times, so it is 0. 0 means no trouble with breathlessness. Okay, 1 means shortness of breath, walking on level ground, or walking up a slight hill. Okay, when there is dyspnea on walking slight hill, then it is MMRC grading 1. MMRC grading 2 means the walks slower than people of similar age on level ground due to breathlessness. Okay, the patient has breathlessness, so he or she walks slower than the people of similar age on the level ground, or has to stop to rest when walking at own pace on level ground. Okay, MMRC grading 3 means stops to rest after walking 100 meter. Okay, when the patient walks for 100 meter, then he stops to take some rest, or after walking a few minutes on level ground. And MMRC grading 4 means too breathless to leave the house, or breathless with daily activities of daily living. Okay, example, dressing or undressing. So the MMRC grading starts from 0. 0 means not troubled by breathlessness, that means there is no breathlessness, and the person is only breathless during the strenuous exercise. Okay, except with strenuous exercise. Okay, in MMRC grading 1, he has breathlessness while walking up a slight hill. In MMRC grading 2, the patient walks slower than people of the similar age, or has to stop to rest when walking at at own pace on the level ground. And MMRC grading 3 means you stop to rest after walking 100 meter, okay, 100 meter, or after walking a few minutes on the level ground. And 4 means too breathless to leave the house or breathless with activities of daily living like dressing or undressing, okay. So to grade the breathlessness of respiratory system, we use MMRC grading, whereas to grade the breathlessness of the cardiac causes, we use NYHA classification, okay. The NYHA classification means New York Heart Association classification, okay. According to it, the breathlessness has been defined classified into 4 classes: class 1, class 2, 3 and 4, okay. 1 means the patient with the cardiac disease, patients with cardiac disease, that means the patients who have cardiac disease. First point is patient with cardiac disease, but without resulting limitation to physical activity. That means the patient had cardiac disease, but there is no limitation to the physical activity. There is no limitation to the patient has cardiac disease, but he has no limitation to the physical activity, and the ordinary physical activities do not cause dyspnea, okay. The ordinary physical activity does not cause undue fatigue, palpitation, dyspnea or angina pain. So the patient only has cardiac disease. There is no limitation to the physical activity. That means he can perform any physical activity, and ordinary physical activity does not cause any undue fatigue, palpitation or dyspnea or anginal pain, okay. And NYHA classification 2 means this patient also has cardiac disease, okay, but he has slight limitation to the physical activity. In NYHA classification, there was no limitation to the physical activity. There is slight limitation to the physical activity. Okay. And third point, in NYHA classification 1, the ordinary physical activity does not cause any undue fatigue, palpitation, dyspnea or anginal pain, whereas in class 2, they are comfortable at rest, but ordinary physical activity results in undue fatigue, palpitation or dyspnea or anginal pain. Also, both of all classes have cardiac disease, but in class 1 there is only cardiac disease. There is no limitation to the physical activity, and ordinary physical activities does not cause any undue fatigue, palpitation, dyspnea or angina pain. But in class 2 there is slight limitation to the physical activity, but they are comfortable at rest. But when they do any ordinary physical activity, there is undue fatigue, palpitation, dyspnea or anginal pain. Okay. NYHA classification 3 means this patient also has cardiac disease, but second point, slight limitation to the physical activity, but there is marked limitation to physical activity. This point is different than in NYHA classification 2. Third point, comfortable at rest, okay. NYHA classification 2 also comfortable at rest, 3 also comfortable at rest. Okay. Fourth, ordinary physical activity results in a dyspnea. In NYHA classification 3, less than ordinary activity results in dyspnea, palpitation and undue fatigue. So NYHA classification 2 and 3, let us see the difference. In point number 2, there is a slight limitation to the physical activity, but there is marked limitation to physical activity. Both of them are compatible at rest, but in NYHA classification 2, there is ordinary physical activity results in the undue palpitation, fatigue, and the dyspnea or ancial pain, whereas in the NYHA classification 3, less than ordinary activity causes undue fatigue, palpitation, dyspnea, or ancial pain. Okay. NYHA classification 4. NYHA classification 4 means this patient also has the cardiac disease. Okay, but inability to carry out any physical activity. Second point is inability to carry out any physical activity. Okay, that means in NYHA classification 2, there was marked limitation to the physical activity, but in NYHA classification 3, there is the patient is unable to carry out any physical activity. Third, in NYHA classification 2 and NYHA classification 3, both these patients were compatible at rest, but in NYHA classification 4, symptoms may be present at rest. Okay, this point is different. Inability to carry out any physical activity, symptoms may be present at rest. Okay, at rest also symptoms can be present. And fourth, if any physical activity is undertaken, then discomfort is increased. So let us compare all these classifications in NYHA 1, 2, and 3 and 4. In classification 1, 2, 3, and 4, first point is same, patient has cardiac disease. But second point, in NYHA classification 1, there is no limitation to physical activity. In class 2, there is slight limitation. In class 3, there is marked limitation, and in class 4, there is inability to carry out any physical activity. Okay. Point number 3. The ordinary physical activity does not cause any undue fatigue, palpitation, dyspnea, or angina pain in class 1, whereas in class 2, they are in class 2 and class 3, they are compatible at rest, but in class 2, ordinary physical activity results in the undue fatigue, palpitation, dyspnea, or angina pain, whereas in class 3, less than ordinary physical activity results in undue fatigue, dyspnea, rest, whereas in class 4, okay, symptoms may be present at rest. Okay, and if any physical activity is undertaken, discomfort is increased. So if the patient has any symptom at rest, then the patient directly belongs to the NYHA classification 4. Okay, thank you.